My name is Adamson Ndhlovu. I'm a medical doctor by profession. I currently work for an non-governmental organization, which is helping the Ministry of Health or the Government Republic of Zambia in achieving HIV epidemic control. I studied postgraduate diploma in diabetes with the support from the Merck Foundation in 2019, and ever since then I've been practicing to improve healthcare outcomes for people living with HIV who especially have non-communicable disease. So the postgraduate diploma in diabetes that I studied with support from the Merck Foundation was offered online, and I was learning, took the modules for the course whilst also working. It was very convenient for me that I didn't go into school full time, but I was doing several things at a go. And the content was very beneficial. It helped me apply my expertise to my patients in ways that I never thought existed. And in terms of the soundness or the relevance of the content from the course, I would say that it was very beneficial and helped me to help improving patient outcomes in the field of diabetes in our country. So from the time that I graduated in 2019, I have taken a leading role to provide technical expertise to our frontline workers in management of people living with HIV who've got other non-communicable diseases like diabetes. This is something that I never did as well or better than before I started before I graduated, I should say. Since then, I've made sure that when we are providing support in terms of skills transfer to people living to our frontline workers who are managing people living with HIV, I have made it as a routine to ensure that the people that have got non-communicable diseases such as diabetes, and even awareness in our staff to screen more people living with HIV for this very common condition, diabetes, because of the condition itself, but also even the medication that we give. I've made it a routine to ensure that they are more aware to screen and provide the services according to the capacity and the level of care. Mostly, I would give an example. We had a case that was quite difficult to manage sometimes back at one of the facilities where I was providing support. We had this person living with HIV who had diabetes as well. So we made a case review after ensuring that the patient was managed well. We made that case review and presented on a national platform where we had to disseminate the knowledge on how to better manage that patient so that broader teams across the country could learn from that. So I found the content from the course very beneficial in that it has placed me at a position where I'm able to provide services to people who with diabetes in my area of field so that they are better managed for better and improved treatment outcomes. So in terms of my long-term plan, I will continue to offer my support and transfer my skills to frontline workers in our facilities that we support to ensure that they better manage people with non-communicable diseases, including diabetes, in the facilities. Beyond this, I plan to further my studies in non-communicable diseases broadly, because I think that diabetes is only one part of the bigger picture of the non-communicable diseases. And looking at how common these are in the general population and including people living with HIV, I think that this course has opened up my eyes and given me a platform to venture into non-communicable disease career more broadly than before. I would highly recommend any person who wants to pursue the diabetes course with support from the Merck Foundation or any other course in any of the specialties. So any medical doctor who wants to further their studies, I think that this offers a very good convenience in that you'll be learning whilst you are working, and the skills that you gain from the modules or the course content that you get will place you at a platform where you'll be better able to manage your patients and also to excel in your career more broadly. I wish to thank the Merck Foundation for their support in according me this opportunity to get a postgraduate diploma in diabetes from an overseas university, and for the capacity that this has built in me and broadened my career prospects in the future.